Hello, everybody. How is everybody doing today? I hope everybody's doing well. We have a new class to work on today. Today's class will be talking about drugs, alcohol, and how everything affects your systems and your health. As usual, I will be sharing a presentation with you. Remember to put your doubts and questions underneath if you have any questions or doubts for us, and we will be glad to answer them. So let's go ahead and begin. Okay, so as promised, today we're going to talk about drugs and how drugs affect your body. Now, there are many different types of drugs, not only what they call recreational drugs like alcohol, but also the use of medicine or the use of narcotics as a drug or as an addicting substance can fall into this category. Now, today's class is only half an hour long. We cannot go into all the intricacies and into all the details of how much it affects your body, but I promise we will be doing that on our next class, which is an hour long. And we will go into a lot more detail about specific drugs also. Today we're going to do a general overview of what, in general, how drugs and alcohol affect your health. And like I said, don't forget to write down your doubts and doubts and questions so that we can address them. So, different types of drugs affect your body in different ways. And the effects associated with drugs can vary from person to person. How a drug affects an individual is dependent on a variety of factors, including body size, general health, the amount and strength of the drug, and whether any other drugs are in the system at the same time. Think about that for a minute. You have a variety of factors that make the effects these drugs have on you different. So maybe, let's say alcohol. Maybe you have a glass of wine every day. It might not affect you the same way as it will do your cousin, or as it will do a person older than you, or a different sex as you, or somebody that's thinner or heavier. Also, you also have to think the amount. So we have to take all that into consideration when talking about the effects. It is also important to remember that illegal drugs are not controlled substances, and therefore the quality and strength may differ from one batch to another. Think about that. When a person creates a dependency on a medication, these medications, because they're quote-unquote prescribed or thought to be prescribed, they're what they're called controlled substances. In other words, they have been through a series of checkpoints to make sure that these substances are made for human consumption, whereas an illegal drug has not gone through those checkpoints, has not been created as a substance for human consumption. Drugs can have short and long-term effects. These effects can also be physical and psychological and can include dependency. So there's 4 types of effects. Think about it. Short-term, long-term, physical, and psychological. Now, if you want to go further, you can talk about short-term and long-term physical and short-term and long-term psychological. You may act differently, you may feel differently, and think differently if you have taken drugs. And you may struggle to control your actions and thoughts. You might begin to use drugs without thinking about any harm to your body. You might think drugs won't become a problem because you're only a casual user. The more you take a drug, the more likely you are to build up a tolerance to its effects. This can lead to the need to take larger doses to obtain the effects of the drug. Think about that for a minute. Same thing happens with any kind of drug, including controlled substances. The more you take it, the more likely you are to build up a tolerance for it. This includes, like I said, legal and illegal drugs. For this reason, evidence suggests that after prolonged use, many drugs can cause dependence. Here we are talking even including the legal drugs or controlled substances. Drug dependence can quickly begin to affect your psychological and physical health, and can also affect your work and social life. Think about it. Psychological, physical health, work, and social life. It is important to remember that there is no safe level of drug use. Be careful when taking any kind of drug. Now, of course, different drugs will have different effects. Drugs affect your body's central nervous system. They affect how you think, feel, and behave. The 3 main types are depressant, hallucinogens, and stimulants, meaning drugs that will make you feel down, drugs that will make you hallucinate, and drugs that will stimulate your system, will make your system go faster. I'll go into explanation of these. Depressants slow or depress the function of the central nervous system. Again, they slow down or depress the function of the central nervous system. They slow the messages going to and from your brain. In small quantities, depressants can cause a person to feel relaxed and less inhibited. Alcohol will fall into this category. In large amounts, they may cause vomiting, unconsciousness, and death. Depressants affect your concentration and coordination and slow your ability to respond to situations. It is important to not operate heavy machinery while taking depressants. Alcohol, cannabis, marijuana, GHB, opiates, meaning heroin, morphine, and codeine, and benzodiazepines, which is the minor tranquilizers, are examples of depressants. So again, depressants will slow or depress the functions of your central nervous system. Now the second type is hallucinogens. These distort your sense of reality. You may see or hear things that are not really there, or see things in a distorted way. Other effects can include emotional and psychological euphoria, jaw clenching, panic, paranoia, gastric upset, and nausea. So, hallucinogens distort your sense of reality. So it can be either you see or you hear things that are different to reality. And it can have effects on your emotional or your psychological well-being. Not including, of course, your physical. Now, examples of these drugs can be ketamine, LSD, PCP, magic mushrooms, and some kinds of cannabis are examples of these kinds of drugs. Now, stimulants speed up, accelerate, or stimulate the central nervous system, meaning they speed up the message from the brain, making you feel more alert and confident. But this can cause increased heart rate, blood pressure, and body temperature. So everything goes up. Your heart rate, your blood pressure, your temperature, but you reduce your appetite, you reduce your agitation, and you reduce your sleeplessness. In large amounts, stimulants can cause anxiety, panic, seizures, stomach cramps, and paranoia. Some examples of stimulants are caffeine and nicotine, amphetamines, for example, speed and ice, cocaine, and ecstasy. These are some examples only. There's, like I said before, there's many different kinds. So then, let's summarize. There's 3 types of drugs. The depressants, the ones that are slowing or depressing your central nervous system. Hallucinogens, which distort your reality because you see or hear things that are not there, or you see or hear things in a distorted way. And stimulants, which speed up or accelerate or stimulate the central nervous system. Now, what are the risk factors? The effect of a drug or how long they last depend on several factors. They depend, like we had talked about before, the type and strength of the drugs that you use, how the drug was made. Substances manufactured in home labs may contain bacteria, dangerous chemicals, and other unsafe substances, and have an unknown strength. Even one dose may cause an overdose that leads to brain damage or death. Another factor is your physical characteristics: height, weight, age, body fat, and metabolism. Another factor to consider is the dose that you take. How often and for how long you have been using drugs. And then how you ingest the drug. Do you inhale it? Do you inject it? Do you take it orally like a pill? Compared with swallowing a drug, inhalation and injection are more likely to overdose and dependence. Now, make note here, it says more likely. It doesn't say that swallowing a drug does not cause dependence. It just says it is more likely if you inhale it or you inject it. If you are injecting drugs, sharing injecting equipment will increase your risk of contracting serious diseases such as hepatitis and HIV. It will also increase your risk for serious infection. Another factor is your mental health, your mood, and your environment. That is, whether you are in a secure, happy place or if you're in an unsafe place. All these can affect your experience. If you have a mental condition, drugs may exacerbate, meaning it will increase or complicate the symptoms of that condition. Another risk factor is whether you mix drugs, including alcohol. Alcohol use may lead to high-risk behavior, such as drunk driving, which can result in serious injury or death of others or yourself. Now, what kind of physical effects can we see from drug use? Physical effects. Drug use can affect short and long-term health outcomes. Some of these health outcomes can be serious and possibly irreversible. Think about that for a minute. Irreversible. Even one dosage can cause irreversible effects on your physical health. Drug use can lead to risky or out-of-character behavior too. So when affected by drugs, you are more likely to have an accident. If you're in a car, if you're at home, wherever. You may be more vulnerable to sexual assault, or you may engage in unprotected sex. Either of these could lead to pregnancy or to an STI. You can commit a sexual assault or other violent act. You may find it hard to sleep, think, reason, remember, or solve problems. Drug use can also result in long-term outcomes. Now, these are the first ones we mentioned were only short-term. These are the long-terms. Harm to organs and all the systems in your body. There is not one system in your body that will not be affected by you consuming drugs in some sort of way. It can result in cancer, for example, lung cancer. It can result in infectious disease because you're sharing injecting equipment. It can result in harm to your baby if you're pregnant. It can result in acne or skin lesions if the drug causes you to pick or scratch at your skin. It can cause needle marks or collapsed veins if you inject regularly. Baldness or a male pattern of hair growth in women, such as facial hair. It can cause jaw and teeth issues, bad breath, cavities, and gum disease. It can cause, of course, mood swings, erratic behavior, psychosis, of course, addiction, and accidental overdose. And, of course, it puts you at a higher risk of mental illness, depression, suicide, and death. I'm going to let you think about those effects for 1 minute before I go on to the next one. Think about all the short term and think about all the long term. Like I said at the beginning, this is not everything. This is not even going into that much detail. This is just an overview of what drugs can do for you, to you. Now, talking about alcohol. How does alcohol affect your health? Many people enjoy a drink. In fact, alcohol is New Mexico's most widely used social drug. Like all drugs, alcohol can damage your body, especially if you drink heavily every day or in binges. Even small amounts of alcohol are linked to the development of certain diseases, including numerous cancers. Let me read that again for you. Even small amounts of alcohol are linked to the development of certain diseases, including numerous cancers. Alcohol affects your body in many ways. Some effects are immediate and last only a while. Other effects accumulate over time and may significantly affect your physical and mental health and, of course, your quality of life. How much harm alcohol causes your body depends on how much you drink, your pattern of drinking, even the quality of the alcohol you drink. Depends on your body size and composition, depends on your age, drinking experience, genetics, nutritional status, metabolism, and social factors also. Like I said at the beginning, drugs will not have the same effect on everybody. Every machine, every system, every body is different. So we will all have a different reaction. So what are the short-term effects of alcohol? Short-term effects of alcohol of a single occasion of drinking can include lower inhibitions, interpersonal conflict, falls and accidents, altered behavior, including risky or violent, of course, a hangover, and alcohol poisoning. The severity of the short-term effects of alcohol typically depends how much a person drinks, but other factors such as hydration and food consumption also play a role. You got to think about that for a minute. How much these effects have on you depends on how much you drink and all the other factors we talked about in the previous slide. Now, what is binge drinking and how does it affect your body? We talked about this in a previous slide. Generally, binge drinking means drinking heavily over a short period of time with the intention and result of getting immediately and severely intoxicating. So think about when you sit there and you say, hey, let's all do shots. That is binge drinking. In the short term, binge drinking may result in a hangover, alcohol poisoning, or any of the other short-term effects of alcohol consumption, such as accidents and violence, as we discussed before. In the long term, binge drinking can result in any of the long-term effects of alcohol consumption, such as heart disease, cancer, liver cirrhosis, and diabetes. We're going to go into the long-term effects in a minute. So, how do you avoid or reduce the effects of alcohol on your body? The best way to avoid the effects of alcohol on your body is to not drink alcohol. Let me read it again. The best way to avoid the effects is to not drink at all. This is especially important if you're trying to get pregnant, if you are pregnant, or if you're breastfeeding. And there is no safe level of alcohol use that has been identified. Again, even one glass of wine has not been identified as safe. If you do choose to drink alcohol, low-level drinking is better for your body than heavy drinking or binge drinking. The national guidelines to reduce health risks from drinking alcohol say that the lifetime risk of harm from drinking alcohol increases the more you drink. Let me summarize that. The more you drink, the more harm you'll come to. For healthy men and women, they advise: 1. Drinking no more than 10 standard drinks per week, people. We're not talking per day, we're talking per week. No more than 10 drinks per week, which will reduce the lifetime risk. And then drinking no more than 4 standard drinks on one day. Again, 10 drinks per week or no more than 4 drinks on a day. The less you choose to drink, the lower your risk of alcohol-related harm. For some people, not drinking at all is the safest option. It is important to monitor your alcohol consumption as part of a healthy diet. Alcohol consumption has the potential to cause weight gain and obesity, depending on how much someone drinks, the type of drinks consumed, as well as the makeup of each individual and several other factors. Think about how much sugar, whatever it is you're consuming, has. And of course, let's talk about the long-term effects of alcohol. Historically, it has been believed that consuming on average more than 2 standard drinks a day is what can cause many long-term health problems and other harms. That is, on average of more than 2 drinks. Nowadays, current research says that any level of alcohol consumption can increase risk of chronic disease development. Okay, so that thought where we said, oh yeah, 1 or 2 drinks a day, you will be fine. No, any level of alcohol consumption will increase your risk of chronic disease. So, like it says here, the World Health Organization says that alcohol contributes to more than 200 types of diseases. But we're going to go through some of the most common ones. Road and accidents, violence, crime, family breakdown, social dysfunction, cardiovascular disease, meaning heart disease, cancers, diabetes, malnutrition and vitamin deficiency, being overweight or obesity. It causes risks to unborn babies, liver diseases, mental conditions, anxiety and depression are amongst them. Alcohol tolerance or dependence or even addiction. It also causes long-term cognitive impairment and, of course, self-harm. So, now this is a number for 2016. We need to check on the current numbers, but in 2016, 5% of all deaths in the world were caused by alcohol. Of course, more men die of alcohol consumption than women, but that doesn't mean it isn't a high percentage. So, in the long term, alcohol consumption can affect all aspects of a person's life: physical, mental health, work, finances, relationships, everything. So think about that for a minute. Everything that all of the drugs will affect. So, these, as I had mentioned before, is just an overview of everything that drugs can do to you, to your health, to your body. There are so many things that I did not mention, but that are worth researching. If you're curious, all you got to do is get online and research how do drugs and alcohol affect your body. Now, there will be another class next week on a little bit more detail about this. So I look forward to seeing you again. I hope this was educational, superficial, but educational. And I will see you next week. Again, my name is Maria Di Blasi. And if you have any questions, feel free to leave them in the comment on below. Thank you and have a nice evening.